The Kenya National Union of Nurses has today issued a strike notice starting September 1st. Now, the union has asked citizens to remove patients from public to private hospitals by 30th of August. Now, according to the union, the strike applies not only to nurses but all health workers, warning the county government that the strike will last as long as the government refuses to listen. But even as the union issues the strike, nurses have moved to court to contest the legality of the union's current leaders, saying that they did not elect them into office as provided in the constitution. Well, the nurses now want a fresh election, and we have Linpai Kioko, who is a union official, joining us from our city center studio. Thank you very much, Kioko, for joining us this afternoon. Briefly tell us, what exactly, are the lamentations by the nurses? What are they agitating for?
Basically, what we are telling the county government is, one, to promote nurses. There are nurses who are due for promotion and redesignations, which are actually long overdue. We are asking the government to implement a circular by the SRC which requires them to pay nurses and health workers a higher house allowance. We also ask the government to employ more health workers because the facilities are lacking health workers. Hence, we are not giving quality service just because the government cannot employ enough working staff. We are also asking them to pay salaries timely because actually we've been getting our salaries as late as 20th of the month, whereas the landlords do not know about that. The school requires me to pay fees in time. However, we also want harmonization of salaries and remunerations because we cannot be working in the same station with my colleague, and this one is getting this salary, another one is getting another salary, and we are all both qualified the same way and working the same working area. Again, we are asking, we are actually asking the parliament that we have a bill the health bill. We require that the human resources go back to national government. Let the county work on infrastructure and buying equipment, putting up buildings and drugs. But as per human resource, let it go back to the national government because, as you can witness in the recent days, there are strikes everywhere in this country. That means they have basically failed on management of human resources. Yeah.
Okay, have you been, in talks with officials from the county government as until today? Have there been any talks?
As of today, we have not had any talks. We have tried to initiate talks. We have written to them letters regarding the same, but they have not called us for any talks.
Tell us about the scope that that will be there when the strike begins. You mentioned 1st of September. Who is it going to affect? Which hospitals are going to be affected by this particular strike in Nairobi?
What you are saying is that once the Nairobi health workers go on strike, all the public facilities will be grounded because all the health workers will basically come out and agitate for their rights. We therefore advise the public that come that date, they should take their patients to other facilities where they can get the service so that we don't get them in a very awkward situation.
Right. Thank you very much, Kyoko, for that, for the insights that you've given us. Of course, the nurses are agitating for promotions, implementation of a new house allowance package, and the shortage of staff. That's also something that they want to be looked into by the county government, among other things.